Hey, Ashley, thanks for kind of sticking with us through those difficulties a little bit. You can't see me right now, I don't think. This is Jordan Wally. We've met a few times, but
Stand there, you can.
I could stand. I don't think she needs me on screen, anyways. Do you want me to
I
turn
can
it
hear
over?
you, Jordan.
All right. So this is the group with Anderson County Schools, the administrators. These are the principals, and we wanted to bring them in here to kind of train everybody on the referral process with Care Solace. So this is Ashley Klein. She works with Care Solace. She's going to be kind of walking us through and our contact with them.
All right. Are you guys ready to get started?
Yeah,
Yes.
I think we're ready.
Yes.
Okay, perfect. So I'm assuming everyone can see me on a screen. If so, hello, and thank you for allowing me to join today. My name is Ashley Klein. I am your point of contact for the Care Solace Partnership. I work on our customer success team. I do have my colleague Sophia on the call as well. She's just here to observe today. But what I'd like to do today is walk through a presentation to explain who we are, what we do at Care Solace, and then show you the platforms available to you. Also, I'd love to help you all get your CareLoop accounts up and running today. So we will do that registration at the end. It only takes about a minute. And everything is live, so it's really just a matter of training this team here and any of our mental health teams there at the district, and then you're able to start using Care Solace right away. If you have any questions, there should be a few minutes at the end, and I'll be happy to answer those then. So with that, I'm going to go ahead and share my screen, and we'll jump right in. All right. So Care Solace, we are a mental health care coordination service, and our mission is to calm the chaos of the mental health care system. We're currently partnered with over 4,500 schools and districts across the U.S., and we work in both K-12 and higher ed. And we're reaching around 3.5 million students. But when a district like Anderson partners with Care Solace, we're not only available for your students, we're also available for all of their family members, as well as all staff and staff families. So our aim is really universal access within your school community. With that, we're currently reaching around 13 million people and saving an average of 400,000 hours in care coordination. Care coordination meaning outreach to providers to see what insurance they take, if they have availability, following up with families. We're really here to do that legwork for you. Now, the reason we exist is because so many barriers can pop up in the mental health care system that prevent families from getting connected to that care that they need and deserve. These are just some examples of barriers that families face. Could be social stigma of seeking help in the first place, a language barrier, finding a provider who takes their insurance or has sliding scale options, and even once they find a provider, having to navigate a specialization fit or a capacity issue. So our whole goal is to help break down these barriers. We want to hold families' hands throughout that whole process and bridge this gap between the person who needs help and the provider who's willing to do so. The way that we do that is through these key services we offer. At the heart and soul of our organization is our Care Companion team that you can see here in the center. The Care Companion team is a 24/7, 365 multilingual support team. They work directly with the families by calling out to providers on the family's behalf, making sure the provider takes the family's insurance, helping them set up their first appointment, and following up to ensure that they're happy with that provider. This Care Companion team can be leveraged through either of the two Care Solace platforms that you see on the outsides here. I'm going to show you both platforms today, but at a quick glance, on the left, we have CareLoop. CareLoop is an internal dashboard only available to admin like yourselves and mental health staff. This is where those teams can make referrals, or what we call warm handoffs, to our care companions, and then we do provide real-time tracking so you can see updates on these cases. Care Match on the right here, this is a second platform, and it's a self-service option for any stakeholder in the Anderson community. This is where folks can go to either search for local providers that fit their specific needs, or to connect directly with our care companions in a sort of self-referral type process. When they do so, it's completely confidential. Our database currently has over 300,000 verified providers. These range from options such as individual therapy to marital family counseling, to inpatient programs, intensive outpatient programs, detox centers, etc. We have no financial relationship with any of our providers, which allows us a really ethical and unbiased matching process. And so we match your families based on the following criteria: the insurance they accept, ages and specializations they work with, location, and of course, availability. Just to touch on this insurance piece, we do work with families regardless of whether they have private insurance, public insurance, or no insurance. For any family with no insurance, we'll work to find them a sliding scale out-of-pocket option. To review our services here, we help to coordinate care for mental health and substance use treatment. We do not diagnose, assess, or provide any treatment. We're here to link your families to those licensed professionals who do so. And then lastly, our aim is to work alongside your school staff and school-based services. We want to be a complementary support for your team, take that burden of care coordination off your plates, but keep you in the loop each step of the way. I do want to note, we do have a licensed team as part of our team. They oversee the care companions, and they can jump into any cases if their help is needed. And then if you're wondering, when might it make sense to utilize Care Solace? So if your school-based services are at capacity or unavailable, for example, maybe there's a wait time to see a counselor or a therapist, maybe it's a weekend, a holiday break, etc., where they just don't have the same access to those school-based services. We are available 24/7. If the need exceeds the scope of a school-based service, so this might be someone who needs more intensive or ongoing care, it could be help for the parent of one of your students, and so we are here to provide support, like I mentioned, for families of students and staff as well. If that person prefers a community-based resource, this could be anyone who's just wanting this to remain a bit more private. They can always contact us directly, and when they do so, it's confidential. And lastly, to help coordinate aftercare. So during a hospitalization or a 5150, we can help to coordinate into an inpatient or intensive outpatient program to try to make that transition as seamless as possible for the families. Last thing to note is that we are not a crisis response service. So if someone's an immediate threat to themselves or others, we do ask that you call 911 or the National Suicide Prevention Hotline. However, please rest assured that our screening team is trained on how to navigate those calls if they do come into our team. All right, I'm gonna go ahead and switch my screen share here so I can show you those platforms I mentioned earlier. This first one we're taking a look at is what we call Care Loop. Care Loop is an internal platform, again, only available to admin and mental health staff. So Ashley here is a hypothetical school principal, for example. On Ashley's dashboard, these are all of the student cases that she has referred to Care Solace via that warm handoff process. There's a status bar with each case, so you can glance and see where we're at in the process of appointing these families. For the handoff, I won't fully walk you through a handoff today, but the only information we need for this warm handoff referral is the student's name and language and the parent's name and phone number. I will show you, there's somewhere in here where we have a tutorial video on how to submit a handoff if you ever need to do so. What I do want to show you though is under each student's name, there's an orange case details button. This is where we provide you a timeline for these cases. So when I click on Michael's case, for example, it pulls up the timeline. In the top right, we can see the care companion assigned to Michael's case. Each family works with one care companion from our team throughout the process. So if whoever submits this referral needs to get in touch with Shelly, for example, they can send her a message right here through the timeline. And then I'll scroll to the bottom here so we can take a peek at what the full timeline might look like. So we'll let you know when we've received the information for the case. From there, we send the parent or guardian a text message to complete their pre-screening. If they'd prefer to talk to someone on our team, they can let us know and we'll give them a call and do that screening over the phone. Once we know what type of provider they're looking for, what type of insurance they have, etc., we'll start making outreach on their behalf. And then as soon as we find at least 2 matches that fit the family's needs, you can click the orange button to see the resources that we've found. As soon as we have 2 options, we present those to the parent or guardian. And from there, it's really up to them. If they prefer to schedule the appointment on their own, they can absolutely do so, and we will follow up to make sure that they were successful. If they'd like some help in scheduling their first appointment, we'll schedule a conference call and we'll call the provider together. Unfortunately, we're unable to schedule an appointment on behalf of the family because typically they need some more information than we store on our side, but we can absolutely be there as a support for that process. Now you'll see here in the timeline, we also log all of the communication. So text messages, emails, phone calls, voicemails to and from the parent and the care companion that they're working with. This allows your team to just stay in the loop, see when the last time we communicated with these families was. As soon as we do have an appointment scheduled, we'll let you know the day of that appointment and with which provider. And then we always follow up day after first appointment as well as 2 weeks later. We want to make sure that they're happy with this provider we've matched them with. If at any point they let us know that it's not feeling like the right fit, we'll start over and we will find them a second option. Last thing to note here in the timeline is you'll see someone has been added to this case. So this is a collaborative tool, and it's this orange share button on the right-hand side of the timeline. And it allows whoever submits a handoff to share the case information with someone else on their team. So say, for example, I'm the school counselor or the school therapist. I submit a handoff for a student. Maybe I've been working really closely with my school principal and also the social worker. All three of us have kind of been supporting this family situation. I can go ahead, click this share button, type in my colleague's email, and click add. Michael's case would then pop up in both of their dashboards as well. This person you add does have to be a registered CareLoop user, so it won't allow you to share a case with just anybody. All right, so that's that handoff and timeline feature. There are a few other things I do want to note here in your CareLoop accounts. First is up top, you'll see a utilization tab. We do provide live utilization data for anyone registered under an admin role. So if you're site admin, you'll see data for your specific school site. And if you are district admin, you'll see data for the whole district. In here, we track your demographics that are seeking help in terms of gender, age, and ethnicity, what they're seeking help with on the substance use and mental health side. And then at the bottom, who is helping these families in terms of insurances reported and top 10 places we've scheduled appointments. So really valuable information in here. Throughout the year, you'll be able to pinpoint specific areas of need within your community. Everyone also has access to a help center. So like I mentioned a few minutes ago, there are tutorial videos in here that walk you through everything you need to know about using CareLoop. So if you do have a student or a staff who you'd like to do a handoff for, you can always watch this video to see how to do that. The FAQs is, of course, where we answer our commonly asked questions, but we do also provide some best practices. As a new district to Care Solace, I always encourage folks to take a few minutes to scroll through these FAQs just to get a better understanding of how it is that we can support your community here. Last up in CareLoop is the Resource Center, and this is where we provide you customized messaging and marketing. So we highly encourage consistent messaging throughout the school year about the Care Solace resources, monthly if possible, whether that be through a parent email blast, if you use Parent Square, maybe you have social platforms or a newsletter that goes out monthly. We wanted to make it really simple for you to add some messaging about Care Solace in case you have a family that's going through something. So just to give you an idea of what we have in these different buckets here, under messaging by topic, we do provide monthly templates. So we'll always have the current month and the following month available. These are customized already for Anderson, so it'll have your district name in here. It'll also always have the link where families can go to connect with us directly. So if I zoom in here, you'll see there's always a link here. I'm showing you a demo account, so it has a demo link, but yours will have your Anderson link right in there. These are copy and pastable, so you can keep what you like, get rid of what you don't. Below those monthly templates, we have Evergreen Content covering some more serious topics. So if these are to occur either within your school community or just anywhere and it's affecting everyone, you can go ahead, pull these up, see if they're helpful, again, in that communication with families. In the marketing section, you'll find our flyers, letters for families, business cards, postcards. Most of these are available in English and Spanish. Again, everything's already customized for you, so you can print out right from the top right. And then in our last bucket, our general messaging, we have a mix of things for you here. The one I like to note typically is we do have an email signature, we have social media content, website content, but we get about 1/3 of our calls outside of normal school hours. And so we always encourage districts to add us to their email signature if it makes sense for them. That way, if you do have parents reaching out to you after hours, on the weekends, they'll see this note and know that they can give us a call if they need to. All right, so that is Care Loop. I'll help you to get your account set up in just a moment, but before I do so, I want to switch and show you Care Match. This is the second platform I mentioned. It's a self-service option for any family there in the community or any staff member. Your link for your district is caresolace.com/Anderson. So this is the link I mentioned is on all of the resources. So anytime families see the messaging, they'll know where to go. And when they come to Care Match, they can access the site at home. They do not need a login. They can click book appointment at the top if they'd like to connect with our team directly via email, phone, or video chat. Again, when they call us directly, it's confidential, so we do support them through the whole process start to finish. However, the district won't ever have access to their names or case information. You'll only know how many families have reached out. The second option is to answer the questionnaire, and this is a truly self-serving tool. So if someone is comfortable calling providers, they just need to know who to call, they can use this questionnaire here, select what they're struggling with, and then we ask 9 questions about their demographic information, severity of symptoms, insurance, zip code, and willingness to travel. From there, our system generates a list of providers from our database that match the needs they specified. They'll always get a pop-up reminder that we have a team available to help if they'd like it, but they can X out and continue on their own. So really giving families that choice. Do they want to go through someone at the school and have a warm handoff submitted for them, or do they want to call us directly or search on their own? So kind of leaving it in their hands so that whatever feels best for them, they can go ahead and choose that path. But with that, I'm gonna scroll back here, and I know you're all in the same room there. So if you do have your cell phone, this is a live QR code that will pull up the registration page for the Care Loop accounts. And I always encourage admin to at least set their account up. That way you can see your data and access resources throughout the year. And if you do ever need to do a handoff, you always have the ability. So I'll leave this up for just a moment here. It should pull up a page that asks for your name, school email, probably a preference. You can do your number at work or your cell, the role, and school sites that you work for. Once you fill out that information and submit, you will receive an email, usually comes through within about a minute, asking you to create a password for your account. And just let me know if this is giving anyone any trouble. So once you get that email and you pick a password, it should log you right into Care Loop. Yours will look a little different than the demo account I showed you because you haven't done any handoffs yet. So it should say welcome to Care Solace when you log in. But you all should see that utilization, help center, resource center at the top of the page. I'm gonna switch my screen, so if anyone needs the QR code, just give me a shout. But I just wanted to pull up this last slide, which just has my contact information. If you wanna take a screenshot of this on your phone, a picture, feel free to do so. I'm really here to take care of all of you throughout the year. So our care companions are gonna take care of your families, and I'm gonna take care of all of you, make sure you are successful. If you have any questions, concerns, comments throughout the year, please do bring them my way. It is my job to help you troubleshoot, escalate a case if needed, answer a simple question for you, like where do I find that flyer? Anything you need, just let me know. You can also shoot me a text or give me a call if you ever have a question. And now I know it's not often that folks have questions right in the beginning, but if there are any, I'd be more than happy to answer those now.
No questions, anyone? Is that right? Okay, Ashley, I don't think there's any questions.
Okay, perfect. Well, Jordan, we'll be in touch, and everyone else, thanks so much for allowing me to join, and hope the school year is off to a great start.
Thank you.
All right, take care. Have a great day.